So my name's Alyssa Thomas, and I am a physician liaison with Anne Arundel Dermatology. Anne Arundel Dermatology, they do general dermatology as well as surgical dermatology and cosmetic dermatology. And as a physician liaison, my main goal is to increase the referrals into our practices. So day to day, I am visiting with external providers, meaning a lot of primary care physicians, pediatricians, internal medicine providers that do refer to our offices, as well as those who may not be aware of our services. And I'm just educating those providers on either new services or, again, those who may not know about our services, just to see if we could meet those needs for them. Again, to try and increase those referrals for our internal providers. So that's pretty much my day to day. I also educate the community about the importance of dermatology care, not just the cosmetic side of dermatology. As far as my educational background, I do have a bachelor's degree, and that is what is required for this role. I have a bachelor's degree in psychology, but a lot of the other people on our team have a background in marketing. We do work very closely with our internal marketing team to get collateral that's appropriate for the field about our providers. We receive a 4-week field training as well as training within our clinics. Our providers and our team do like us to have a medical terminology background as well, but it's not required to have that training as long as we do the training within our clinics, just because we are speaking face-to-face with a lot of medical providers. Just as a personality background, listening skills are very important. We do talk with providers, but just listening to their needs and being able to reiterate that back to our internal teams. We work very closely with a lot of directors. Our regional team, Anne Arundel as a whole, has grown exponentially. So just being able to keep that growth, but quality patient care. That's what I enjoy a lot about my role, is just ensuring that patient care is kept to a high standard. That's pretty much the main goal of our role as well. There is growth within a physician liaison role. You start in the field talking to those providers, but again, in a larger company, you could become a regional director of physician liaisons. So then you would be kind of managing a team of liaisons. We also have a director who kind of oversees our special events and helps us coordinate those. I do have a very flexible work schedule. I work remotely for the most part, besides going out on those office visits. But we do special events, which require some evening and weekend hours. But that's pretty occasional, especially post-COVID. After COVID, I would say we had some challenges. We do see a lot of patients who are struggling with insurance. So it's how can we care for those patients and how can we get them proper dermatology care? But overall, I would say we didn't lose anyone on our team. We, as a team, work together to launch the telehealth program. So it's just always finding creative ways to utilize your skills and reach out to those providers and continue that care that they need for those patients. So as far as the physician liaison field, they work not only with dermatology, but in children's hospitals and large medical practices. I hope that clarifies some of your questions as far as what they can do in the field. And I hope you find what you would like to do one day.